coming in from Mumbai now with respect to the city's fight against COVID-19 and steps being taken to ramp up medical infrastructure in the event there is a surge in COVID-19 cases. The St. George Hospital has now been made a dedicated COVID-19 hospital. Let's in fact listen in to a response from the hospital authorities on this matter.
चाइना ने अभी तक जो बताया है, उनके जो केसेस हैं उनमें जो मौतें हो रही है वो सारे ओमिक्रॉन है या ओमिक्रॉन के वेरिएंट है। पर अभी फिलहाल क्योंकि केसेस इतने कम है, मतलब मुंबई सिटी की आपने बात की तो आज मुंबई सिटी में सिर्फ 32 केसेस है। हमारे जेजे ग्रुप ऑफ हॉस्पिटल्स में एक भी केस नहीं है। तो 32 केसेस का जीनोम सीक्वेंसिंग करना आसान भी है और जरूरी भी है, बिकॉज अगर स्ट्रेन चेंज हो रहा है, लोग अभी क्योंकि सिर्फ चाइना नहीं, यूनाइटेड स्टेट्स में केसेस है, जापान में है, साउथ कोरिया में, यहाँ से अपने लोगों का आना जाना काफी रहता है। तो ये इसीलिए हम हर सैंपल का अभी चेकिंग गवर्नमेंट के डायरेक्टिव्स है और हम कर रहे हैं। मुझे लगता है हमारा, मतलब मैं जेजे को एक स्मॉल रिप्रेजेंटेटिव सैंपल बोलूंगी तो हमारा सिस्टम पूरी तरह से तैयार है।
Now, Prime Minister Narendra Modi, Rajya Sabha Chairman Jagdeep Dhankar, Lok Sabha Speaker Om Birla and other members of Parliament were seen wearing masks during the proceedings in Parliament today amid fresh concerns over COVID, which has now, in fact, gone out of control in neighbouring China. Even members of the opposition camp were seen taking precautions. This after members of the Lok Sabha and the Rajya Sabha were advised by the Speaker of the Lok Sabha and the Chairman of the Rajya Sabha, respectively, to wear masks. The Union Health Minister, Mr. Mansukh Mandavia, briefed the Parliament on the precautionary measures that have been taken. He also said that currently the COVID situation is getting alarming and that there's a need to be vigilant and take all precautionary steps, including, of course, wearing masks, using sanitizers and maintaining social distancing.
अब यात्रा को रोकने के लिए बहाने बन रहे हैं। मास्क पहनो, यात्रा बंद करो, कोविड फैल रहा है, सब बहाने हैं।
So that was Rahul Gandhi during the Bharat Jodo Yatra. But let's also listen in to what the Lok Sabha Speaker, Mr. Om Birla, and the Rajya Sabha Chairman, Mr. Jagdeep Dhankar, had advised the members of Parliament.
I urge all the honourable members to be extra cautious about the surging COVID cases in the world. Currently, situation of COVID is getting alarming. We need to be vigilant and take all precautionary steps, including wearing masks, use of sanitizers and social distancing. That we need to join hands and lead the nation by example.
मैं आपका ध्यान विश्व के कतिपय देशों में कोविड-19 महामारी के पुनः सक्रिय होने की ओर आकर्षित करना चाहता हूं। कोविड-19 के पिछले अनुभवों को देखते हुए हमें निरंतर सतर्कता और सावधानी रखने की आवश्यकता है। सरकार ने भी तत्परता से कदम उठाते हुए पूरे देश को कोविड-19 से संबंधित आवश्यक सुरक्षा उपायों के पालन करने की सलाह दी है। मेरा आप सभी माननीय सदस्यों आग्रह है, हम सभी उन सुरक्षा उपायों का पालन करें, मास्क का प्रयोग करें तथा इस संबंध में जन जागरूकता फैलाने में अपना योगदान दें।
Right, so the politics continues over the Bharat Jodo Yatra with Amit Malviya, the head of the BJP IT cell, slamming Rahul Gandhi and what he calls his irresponsible behavior. Mr. Malviya has tweeted saying Rahul Gandhi is a shining example of what an irresponsible leader looks like. He has no compunctions, putting people's lives in peril provided his political agenda is fulfilled. People can die, but he does not care. These are Mr. Malviya's comments. Let me go across to my colleague Mayank for more on this. Mayank, this is a matter that is now only going to, in fact, keep escalating, Mayank, because the Bharat Jodo Yatra continues, and like we saw today when the Yatra was in Haryana, a lot of the COVID-19 norms that have been prescribed have not been followed by the people participating in it.
Well, absolutely. And since the letter by the Union Health Minister Mansukh Mandavia to the Rajasthan CM Ashok Gehlot and Wayanad MP Rahul Gandhi went public, the Congress party went up in the arms saying that the BJP has been, they are fearful of the rising popularity of Mr. Rahul Gandhi, and that's why they are trying to stop the Bharat Jodo Yatra. The war of words have started between the BJP and Congress over the issue of COVID appropriate behavior not being implemented in the Bharat Jodo Yatra. Rahul Gandhi himself came forward today and said that it is just an excuse to stop the yatra. BJP, on the other hand, has always been maintaining that it is just a protocol that has been given by the health minister, and it is not a political vendetta, so to say, that they are not trying to stop Rahul Gandhi's Bharat Jodo Yatra. Rather, they are trying to stop, and they are trying to suggest Rahul Gandhi on COVID appropriate behavior because there are a number of cases rising. Also, the version coming from the health ministry is that the health minister did not take suo motu cognizance of this case, and that a letter was written by BJP MP from Ajmer Bibi Chaudhary about the rising cases, and that there should be a precautionary alarm sent to Rahul Gandhi about this Bharat Jodo Yatra by the health ministry, and that's why that letter was issued. But the war of words have truly begun between the BJP and the Congress party over COVID, over the issues of COVID and Bharat Jodo Yatra.
Let me go across to get a medical perspective on this. Dr. Harsh Mahajan joins us on the broadcast. Thank you very much for speaking to us, sir. Sir, what are the perils, in your view, of actually not adhering to the prescribed norms, especially when you are, being part of large gatherings of the kind that we're seeing in the Bharat Jodo Yatra? Now, of course, the situation in India is clearly not as alarming as what we witnessed in China, but all precautions need to be taken. What's your prescription?
I would say that's absolutely right. We've seen it before. It's not something new. If we are not cautious, if we don't take precautions, if we don't mask up, especially when we are in large gatherings and more especially when we are indoors, then the chance of spread is very high. As has been said, the R0 value of the BF.7 variant that is prevalent and which in China and some other parts of the world is between 10 and 18, which means that one person who's infected may infect between 10 to 18 further persons. So with that kind of R0, we need to be very, very careful. Having said that, there is really no need for panic in our country because we fought the pandemic very well. Over 220 crore vaccines have been given. 97% of our adult population has had at least 2 doses. One cause for concern also, of course, is the low uptake of the precaution dose, which is between 28 to 30%. And that is where we should focus on, apart from masking, social distancing, and, cleaning our hands. We should focus, those who've not had the precaution dose should go ahead and get it as quickly as possible. We do know that it takes anywhere till 2 weeks to actually boost our immunity after this injection. And that is something that needs to be done on a war footing. And those who haven't had it, I would request them with folded hands that they should go and get it. That will improve very much their chances of not getting severe disease. And really, we need to go back to where we started. And even though we have a lot of immunity, yet we should take precautions.
Absolutely. Taking precautions is, of course, the top priority right now. Do stay with us, Dr. Mahajan, because we're also getting some reactions now from the Congress party in response to the questions being asked by the BJP and others over the conduct of the Bharat Jodo Yatra. The Congress party is saying that the centre is doing its utmost to actually stop the Yatra from going ahead. Let's listen to those reactions.
We are very much abiding the rules of this country every time. Whenever the COVID started, we are the party totally abide by the corona guideline. But here, clearly a double standard of BJP, you can see that. Every day Prime Minister is doing rally. 2 days before only he done a rally in Tripura. Whether the Health Minister wrote a letter to the Prime Minister. He is asking the Bharat Jodo Yatra to be stopped. that itself is a clear indication of the success of Bharat Jodo Yatra. This is a certificate for Bharat Jodo Yatra success. Therefore, we are very much aware of this fact.
Today is the 106th day of Bharat Jodo Yatra, and this yatra has reached the state of Haryana, and today Rahul Gandhi has been walking in the Nuh region of Haryana, and as you can see that there is a massive crowd out here who have come here to support Rahul Gandhi in this Bharat Jodo Yatra. But what must be noted there is that none of the COVID norms are getting followed, as that was the concern which was being raised by the central government yesterday. And you can see in the visuals as well that none of these COVID norms are being followed during this Bharat Jodo Yatra. Let us go across to some of the people here, and we have been joined by the Indian Youth Congress President Srinivas Biwi. Sir, आज 106 दिन हो चुके हैं भारत जोड़ो यात्रा के. यहाँ इतना जो क्राउड दिखाई दे रहा है सपोर्ट करने के लिए आए हैं, लेकिन सरकार की तरफ से एक ही बात कही जा रही है कि कोविड नॉर्म्स का पालन नहीं किया जा रहा है भारत जोड़ो यात्रा.
मैं सरकार को सिंपल बात याद कराना चाहता हूँ. डबल इंजन सरकार है. यही लोग पूरा देश में डंका बचा के बता दिया था. 99.9% लोगों को हमने वैक्सीन बूस्ट 1, 2 और बूस्टर लगा दिया है. तो क्या दिक्कत है? अभी इन्हीं का उस लेटर में मेंशन है, जो वैक्सीन लोग डाला है वही लोग आए. तो 99.9% वैक्सीनेट हो गया, तो क्या दिक्कत है?
So this was the Indian Youth Congress President Srinivas Biwi, who has clearly mentioned that the BJP is getting rattled because of the success of Bharat Jodo Yatra, and that is the reason why this concern over COVID has also been raised by the central government. But we are here in Nuh of Haryana, and as you can see in the visuals as well, that there are no COVID norms that are getting followed.
We're just slipping into a very short break. We also thank Dr. Mahajan for giving us his perspective on the prevailing COVID situation in the country. We'll see you shortly on the other side with more news and updates.